Depression in teens. In this video, we'll be looking at a number of important concepts relating to depression in teens. These include 1. Important facts about teenage depression. 2. How is teenage depression different from the blues? 3. Causes of teenage depression. 4. Signs and symptoms of teenage depression. 5. How is teenage depression diagnosed? Let's get started. Wide mood swings are normal in those ages 12 to 18, but to be on the lookout for depression. Teenagers face a host of pressures, from the changes of puberty to questions about who they are and where they fit in. With all this turmoil and uncertainty, it isn't always easy to differentiate between normal growing pains and depression. But teen depression goes beyond moodiness. It's a serious health problem that impacts every aspect of a teen's life. 1. Important facts about teenage depression. It is estimated that 1 in 5 adolescents from all walks of life will suffer from depression at some point during their teen years. Sometimes teens feel so depressed that they consider ending their lives. Each year, almost 5,000 young people, ages 15 to 24, kill themselves. The rate of suicide for this age group has nearly tripled since 1960, making it the third leading cause of death in adolescence and the second leading cause of death among college-age youth. 2. How is teenage depression different from the blues? It's not unusual for young people to experience the blues or feel down in the dumps occasionally. Adolescence is always an unsettling time, with the many physical, emotional, psychological and social changes that accompany this stage of life. Of course, most teens feel unhappy at times. And when you add hormone havoc to the many other changes happening in a teen's life, it's easy to see why their moods swing like a pendulum. Yet findings show that 1 out of every 8 adolescents has teen depression. When teens' moods disrupt their ability to function on a day-to-day basis, it may indicate a serious emotional or mental disorder that needs attention. Adolescent depression. Parents or caregivers must take action. 3. Causes of teenage depression. Hormonal changes. Early childhood trauma. Inherited traits. School performance, feeling of worthlessness over grades. Social status with peers. Sexual orientation. 4. Signs and symptoms of teenage depression. Excessive and inappropriate guilt. Memory loss. Irresponsible and rebellious behavior. Willingness to skip school. A sudden drop in grades. Withdrawal from friends. 5. How is teenage depression diagnosed? There aren't any specific medical tests that can detect depression. Healthcare professionals determine if a teen has depression by conducting interviews and psychological tests with the teen and his or her family members, teachers, and peers. The severity of the teen depression and the risk of suicide are determined based on the assessment of these interviews. Look for signs of potentially coexisting psychiatric disorders such as anxiety or substance abuse, or screen for complex forms of depression such as bipolar disorder, manic depressive illness, or psychosis. Assess the teen for risks of suicidal or homicidal features. If you suspect a teen might be depressed, broach the subject with a low-pressure talk while you're in the car or on a walk. Encourage your teen to confide in someone, if not you, then a friend or a teacher.